Thank you to the organizers for this opportunity, and I will be taking you through this study, comparative efficacy of cryoablation versus robot-assisted partial nephrectomy in the treatment of cT1 renal tumors, a systematic review and meta-analysis which was published in 2024 in BMC Cancer. So, coming to the background of this study, we all know kidney cancer incidence is increasing, and nowadays diagnosis of small renal masses because of incidental finding is on the rise due to imaging. And now we all know that robot-assisted partial nephrectomy is a gold standard, but cryoablation has an emerging role in high-risk patients. So the aim of this systematic review and meta-analysis was to compare perioperative outcomes, that is hospital stay, blood loss, complications, evaluate renal function preservation at 12 months, and assess the oncological outcomes like recurrence and survival. So this is the methodology adopted in this systematic review, where they reviewed around 3,491 articles, out of which they narrowed down to 10 studies, which included 2,011 patients, 1,029 in the cryoablation group, and 982 in the robot-assisted partial nephrectomy group. So they searched PubMed, Embase, Web of Science, and Cochrane Library, which are 4 reputed data sources. And the outcome measures that they studied were as a primary perioperative results, complications, renal function, recurrence, and survival. And secondary objective was to look at the operative time and the clavin complications. So these are all the 10 studies that have been tabulated, but I would like you to look at the 3 studies that I highlighted because these had the most patients included. So all we can see here is the age in the cryoablation arm in all the studies was higher compared to the nephrectomy arm. And the Charlson comorbidity index also was in favor of the operative arm rather than the cryoablation arm. So more sick patients were offered cryoablation in all the studies. And the surgical approach that was adopted in these studies were also a little heterogeneous. So the studies also looked at comparing percutaneous cryoablation as well as laparoscopic cryoablation with partial nephrectomy. So coming to the results section, there was no difference in the OT time when we compare the cryoablation versus partial nephrectomy. There was a favorable outcome in terms of days in hospital in favor of cryoablation. Blood loss was 104 ml less, and the overall complication was also in favor of cryoablation in these studies. But when we looked at minor or major complications in terms of clavin window, there were no differences seen. In terms of renal function, there was no difference, as well as the recurrence-free survival and overall survival of these patients are not different, except for the recurrence rate, which is favorable in robot-assisted partial nephrectomy. That means the recurrences are less when we remove the tumor rather than subjecting them for cryoablation. And the odds ratio of 7.83 is very significant. So the limitation of this study is that it does not have any high quality RCTs included, only retrospective and prospective cohort studies were included. The different techniques of percutaneous as well as laparoscopic cryoablation were included in the review. That will lead to a lot of heterogeneity in the data and make comparison difficult between all the groups. Cryoablation, as I stated earlier, was offered to older and more patients with more comorbidities. Data does not yet support any subgroup analysis, as in which patients T1A or T1B tumors which did better. It was all clubbed together as cT1 tumors. And of course, there is variation in the surgical experience and the equipment used for cryoablation at all the centers. So in conclusion, cryoablation offers a better short-term outcomes in terms of hospital stay, blood loss, and early complications, comparable renal function and survival. But the major drawback is with the cryoablation, there are significantly higher recurrences. So the clinical implication would be that cryoablation, though viable, it can be offered to non-surgical candidates for now, but robot-assisted partial nephrectomy still remains a gold standard for curative intent. So there are future need for better RCTs to validate this. Thank you.